And of course, the topic of the panel discussions today is to discuss digital transformation. So before, and perhaps even just to kick it off, I thought that reacquainted with our panel, I'll just shoot off the first question, and I'll actually take it out of the whole digital environment, and I'll lead with a statement actually provided by Christian to me in our sort of pre-discussions to today. I'll just read out what Christian wrote to me last week, and then perhaps we can pick up the discussion based on the statement itself. So what Christian wrote was that my takeaway from my last 20 years of working with digital transformation is that no matter how shiny and no matter how magic the latest digital tools might look and feel to us, they're still just tools. Digital transformation is always more about the men and women using and making sense of the tool than it is about the tool themselves. So I got very inspired by reading your quote, mainly because I sell digital tools for my day job. So I thought it was an interesting input, actually trying to kick off the discussion about digital transformation with discussing people and the people utilizing the digital transformation. So perhaps my first question to the panel would be, where is it that you, amongst your sort of daily experiences, find that the people engaging with the tools seem to struggle the most by putting them to use? Anyone in the panel who would like to kick it off?
I think it's not just about the digital transformation, but overall, whenever there is a change, there's a fear. And this is the biggest factor. I mean, how many of us do know nowadays how to use a mobile device? And a digital tools, most of them will be supported by yet another app in most cases. But it's the change it's the change management which is difficult, and it's fear. And I don't blame it, on non-digital savvy people. It's equally applicable for even highly digitalized people, or with a completely digital mindset. That at time when you have to start with a new process, you tends to take time, and you need to get over that hurdle. You have to cross the threshold to really go forward. So I think the biggest problem is to get started, and it's the fear in your mind to change that's keeping you down, basically.
Any other comments from the panel, I think?
So I think it's really important when you start with the digital transformation. A lot of companies, they hire a digital marketing manager and they think, okay, no, we've taken care of that part. We have someone in digital. But in the end, and you end up doing many different things. But in the end, especially when you get more ahead with e-commerce expansion, and what we're seeing is that it cannot stay with just one person, or not even with one portion of the company, which would be the e-commerce. It really has to trickle down into all of the organization, and everybody has to be on board, from legal to compliance, medical affairs, professional, trade, the salespeople, and this takes a lot of time to get the engagement, but it's really something which everybody needs to be on board. So it's not just anymore a digital department, it's the whole company needs to digitalize, and you have to do that with a lot of training, be present at all the important meetings, get the right sponsors in higher management. But I think this part, the people part, is really important when we're talking about transformation, because it's a change of mindset for your clients, but especially internally for the whole company.
I completely agree. What I tried to underline in my presentation, or the experience that I tried to share from our company, is indeed that I clearly see in our organization, the marketing and sales organization as well, some need for some new skill sets and an understanding of some interaction between different touch points or different types of data that suddenly become available that were not available before, and how to approach those. For a salesperson, how do you approach a pure digital lead? How do you correctly react on the fact that you have a list of information that that person might not be completely understanding actually is available for the salesperson, and how do you approach that? There are different things. How do you have a marketing manager who really truly understands the reach that communication can have if it becomes digital? Those are things that they are not in our organization, at least, not necessarily trained to. And it's in with the limited means that we have in our organization, being myself essentially, it's patience and long-term work through showing the example on different people, and there are fears, there are concerns, and there is refusal as the default reaction. So go away from me, I don't want to know about your stuff. So bringing them on board one person at a time, that's the only approach that I have found, but that's obviously not possible in bigger organizations.
Well, I fully support all what was said, and in the light of this, what do you think, what does that mean for large companies like Roche? On the one hand, like standing for IVD industry representative, and on the other hand, the Amazons, Googles, Apples of the world. Who will win at the end, right? I mean, the IVD companies invest heavily in getting this data management on board, like there is the joint or the collaboration between GE Healthcare and Roche to combine in vivo and in vitro diagnostic data into one thing, into one set of data, which could potentially, for example, in case of breast cancer, reduce or completely replace biopsies in many cases. And on the other hand, the big IT companies are heavily investing. There's just a few months ago, there was this announcement that Amazon, Berkshire Hathaway, and JP Morgan collaborate. And I mean, anybody knows how much money is behind there. This can move for many things, right? How do you see that?
I was just thinking, because you don't know this, but we have 2 questions on a piece of paper that must have been collected perhaps in advance from or is that you? Is it? Yeah. So one of the questions, because this links up to how do you, which talents do you recruit from the outside? I think your story, you come clearly from a B2C environment, and you have clearly rocked the boat in your company and brought in some dairy things that might not have come from the inside. If we had a specialist from the inside becoming a marketeer, then becoming, having certain responsibilities, sometimes it can be interesting to get some fresh blood from the outside. So the bright light that I see in our organization is some new young people who have, they are digitalized very clearly, and they have some very interesting, very dairy approaches also to how could we. So it's not can we, but it's how can we kind of approach to things, which I thought was very nice, because that's exactly it. And so there's hope in, at least with the younger generations coming in, the shift might happen. Sometimes we just can't wait for that. That's the problem, of course.
Makes sense. I think we had the first questions from the audience here.
So building on the question before of transformation, maybe a question more to Caroline. I'm in the dental business, so I feel kind of linked to what you presented on Icon. How do you deal with the customer behavior change? And by customers, it's your optician in this case, or for me it would be my ortho. Because what we've been discussing is how we instill this digital change in our organization as to going to all the layers and repetition and explaining the benefits. The challenge that I see in the ortho business is how to overcome that resistance of doing always the same. And are we asking our orthos or our opticians to change into a digital environment, or even the end consumers to try something digital, different from what they have always been told is the right thing to do? So if you could expand around your experience around that.
Yeah, so I mean, it's a long process. We started around 3 years ago, and I mean, we've done many different things, but I think the most important is first. We got a key opinion leader within the sector, and we kind of did a pilot phase where we tested our digital platform, our digital initiatives with certain clients to show success. And once you have those, you can call them e-commerce ambassadors within your clients. Then from their success stories, creating road shows, even trainings, webinars, using all our tools to show the success factors to the rest of of the clients, because basically also the concept we had a bit was, are you in? Because it's not, you don't really have a choice to be in. I mean, the market is moving there, and you need to show this with lots of statistics. In Spain, for example, we also showed a lot of statistics of what's going on in northern markets, which are already a bit advanced, and they all know that internet is just increasing, and that they're losing their clients to big internet distributors, and they feel this in their sales, so they know they have to do something, and they want to. Of course, they're resistant because they don't want to do a lot of work, but they know they have to change. But the resistance is more that they don't really know, where do I start. So you have to make it easy for them. You have to give them the right platforms. You have to give them the right content, the context. Basically, you have to do it all for them. Make it really easy. One of our clients said, yes, I'll do it, just don't give me a lot of headaches. So this is kind of the motto we use. And then from there, they're actually proactive to adopt it. For example, in Contact, we have almost all our clients are in the platform because they're convinced, and we convince them through a whole communication plan, through teasering, but especially through our roadshows. That was really important. But now it's the activation. Now the business owners, the hardest part is that they need to show their salespeople, how am I going to sell this new digital transformation to my end patient? So that's the hardest part, is when you really get to the point of making it work at the point of sale. And this is why we created a whole e-commerce coaching team, like train the trainers, to make sure that it's done at the point of sale. So, I mean, it's various levels. No, it's internal, it's the business owners, it's the ones selling inside the store, and you have to work your levels all the way down, and this takes time.
Thank you.
Another question?
Yeah. What is your experience with your regular sales team in promoting, developing your digital efforts, both on marketing and sales side? What are the do's and don'ts, or the considers that you would have in case you would have to do it again, for instance?
With the sales team, so
Yeah.
to get them digital savvy.
Yes, exactly.
We did a lot of training from the beginning. So the whole engagement, are you in? We also applied it internally. So I think one of the well, this might sound a bit harsh, but one of the things that is important is I would have earlier people that are not on board, so that do not know how to sell digital. I mean, this is the future, not the future. This is now, and just like we said, you need to also recruit new talents within marketing, within you also need to do it within sales. Get new people on board as well, fresh blood coming from other industries in your sales as well. Of course, giving everybody an opportunity in the company to get on board with training, but there are people that are really resistant and that have a mentality that will not change. And I think that you need to be kind of vigorous in that sense. And I think, for us, for example, it's not always that case. Then as well, using all your, for example, webinars. Like, we create a lot of webinars now, which are very easy, where our sales can easily, on all kinds of digital concepts, get information. Incentivize as well. For example, the subscriptions we've incorporated now. It's not just anymore about how many contact lenses am I selling, but it's also incentivized on how many subscriptions are my clients selling. Which works really well. And then gamification. So we created kind of a gaming app where they compete against each other on, everyone has an avatar, and they compete on a mountain, and whoever gets the most subscriptions, and they compete as a team together, so per area. These kind of things are very important as well, to create kind of the, I don't know how to say, like the fun side within something where there's a lot of resistance, and will take them time as well. And especially very important is the sales director. There's the number one person that needs to be totally on board with making this a priority.
Thanks.
That's perhaps the carrots. Then there's the stick, which we also apply on particularly on the usage of our CRM and on our mobile sales enablement platform, because there is a lot of data set that actually can be measured, and they know that very well in the sales teams. They are being watched. The system in our CRM, we have set up a quality score, basically because we ended up having endless qualitative discussions around the quality of the data rather than based on quantity and actual facts. And today we have part of the bonus which is linked to the quality score, so information which is missing, which is not updated with the right speed, all very transparent to the sales teams and the CRM and Salesforce. Also linked to the usage or non-usage of the mobile sales enablement platform. It doesn't go very far because we just switched last week, but the platform, but still it's part of the story as well. And of course you can combine that with the carrot. That's even better, of course, in gamification.
I mean, basically from our side, it's team-based selling. So we operate in an orthopedic environment, and of course, a normal sales rep, which is selling orthopedic product. Now you put a digital product in addition in the back, he's not going to sell it immediately. That's clear. Now, how we move on with this task is that we have a team. So got a digital trained salesperson, which might be 2 or 3 person in the whole country, and then you get the normal sales team. The job of a normal sales team is basically to set up that initial knock or to get that initial appointment or to generate that initial interest. And that's 5 minutes follow-up how to generate interest is a script that we provide to the German. So they don't have to answer the hi-fi questions up front. The strategy is to just get an interest and get an appointment where the digital trained or digital product specialist can come in and try to get through the things, get through the clinicians, get through the data security, get through IT. Now when it's back again, when you want to enter the deployment phase, basically. Now, again, you can have the same digital product person, specialist giving the training and so on, but to our experience, it doesn't work because sales, especially in a medical device, is such a relationship-based business. So in a hospital, when you got a sales rep who knows each of these nurses or doctors, he has been interacting with them 5 years or more, at times. And he knows, all right, which are the specialties, where is the positives of one person, where is the negative of other person. So the role of a digital product specialist is to bring it to a level when it's all about deployment, and then it's back to the same salesperson who can basically left with a job to show, okay, if you click here, this happen. If you click there, this happen. Because you have to understand that, yes, train the trainer, but again, your end user is also not a super digital savvy person. So if you cannot train your normal sales rep to do or train somebody as easy to use a platform, you cannot do it potentially. So we go ahead with a very team-based approach, taking it forward, basically.
Sorry. This is not an answer to your question, but I would just like to the reference you had to Steve Jobs on our salespeople probably never really knew that they would need this kind of digital enablement and all these different data that we're giving to them. They would never have asked for it, but there is true empowerment. I'm fearing that maybe I didn't stress that enough in my presentation, but the global feeling of our sales teams having access to multiple touchpoint data at a daily basis and understanding all kinds of interactions that are virtual, that were never visible to them before, that you could go to Google and know that this is happening, but seeing it is believing it, is very strong. And the best proof of that is when sometimes, from time to time, this happens, the system doesn't work or data doesn't travel in, they start contacting you and starting for, understanding why it doesn't work and why I'm not seeing this data, whereas you could have some doubts of whether they were even looking, but it seems that they are. So this is important, and I think it's just going to drive them into one day really using this in the right way. But it's all very new in our case.
Well, we are currently introducing a CRM system with the expanded sales team. We think that's the right time to do it, but I would be interested in experience kind of from here or from the audience with CRM usage in selling services. In our case, the first sale is typically a development service, not a product. At the end of the day, they get some prototypes, products, and at the end of the day, there is a manufacturing agreement. But it's rather complex, and the quote for development can easily be 30 pages with boundary conditions, you name it. How do you really, in an effective way so that compliance is high, document all that in a CRM so that there's a value for everybody involved, not only tracking how much are they doing? Anybody has an experience here? on something like that? Okay.
It seems that's one we have to park for the future. Then
I can maybe share some idea. It's not on the level of where you are at, where you're Intel Insight type of selling, but when we come to doctors, which are completely traditional orthodontists, and you try to sell a service that includes the best product in the market, we start our conversation about a simulation of what good looks like, and what we use from the CRM app, much like presented by Christian on the links and the funnel and how we get them through, is that we don't stop at the CRM app. We have Salesforce.com. We developed a different app, which is the app that they use to selling the services and the products and interlink them and personalize the simulation to the doctor that they're talking to. So, doctor, here's where you are today. Here's what success looks like, and here's how we can help you to get there, should you choose to do more than just buying the product. That's a bit the experience. Is it easy? Sales tool, but it's a lot of training on how to change your approach from the milkman approach to value added into the practice from a TM perspective. At the same time, since it's clinically driven, what we do is we bring in also remotely the clinical advisor, who's like the clinician who talks and on the same level than the doctor on orthodontic terms. You have the sales guy going in, and then you have the customer service guy calling as well to try to make a triangle, and then bringing the doctor forward of already showing them what it means, not only being taken care of by a sales rep, buy this, move stock away. It's completely different from that. That's the consequence, but it's not the aim of what they're trying to do. Not sure if that.
We don't have experience with this in particular, but I'm thinking that several mobile sales enablement solutions that are deeply linked up to CRM systems as well will be able to come up with solutions of applying, depending on the person you're talking to, depending on the kind of interaction you have across a global project, that can bind all these things together in a thing that holds water and makes sense for everybody back in the CRM, but also when you actually are facing the customer or the different parts of people, very similar to tender processes as well, where you will have multiple people that you talk to, very different questions, so you need to be able to bounce back and forth among a variety of different arguments and resources that you can share that way.
And of course, I shouldn't interrupt. I know of a Danish tech company you could speak to that would probably be able to help you just on the topic. But so taking the discussion perhaps over here. Sorry, we had a question.
Yes. Hello everyone, my name is #Yugoslav, working in www.alcon.com, #surgical ophthalmic instruments. So actually I work in the same company as Caroline. The only difference is that she's in vision care, I'm in surgical department, and it's interesting that I had to come here to this conference to realize that vision care is at this level of digitalization and surgical is at this level. So actually my question is, do you see any opportunities how we can, within the company, work more together so that the surgical part as well can reach this level of digitalization that you have in the vision care? And do you see some opportunities and maybe have some suggestions how we can do that?
Thank you for that question. Yeah, definitely. And I do think, we have kind of a track record that vision care and surgical has always been quite divided, and especially in the marketing of how we do marketing, and vision care goes much more direct to the consumer because we can, and in surgical we can't. But I think that's not really what the future, what it's looking like, because the direct to consumer is an important part, whether we're in vision care or whether we're in surgical. There's just the difference that I think in the surgical case, we need to do it, let's say, the same way actually we've done it in vision care, is get the B2B on board. So really, we might be more dependent on our B2B in the surgical case because we have more restrictions of what we can actually say about our brands, about our products to the consumer. But in the end, it's the same, because what we're doing is we're providing a platform, we're providing a toolkit, we're providing content, we're providing context, we're explaining to our B2B be what is the consumer journey, where do I have to be present, how do I talk to my consumer, or in your case, patient. So I think there's a lot of similarities that we can do. I mean, basically the toolkits that we create, even though it's concerning different products, in the end, I think they can be used in surgical as well. It will change obviously of what we are selling, but in the end, there are service experts as well. So I definitely think there's a lot to maybe create synergies or maybe transport from the vision care to the surgical department. But I think at the same time, it might seem like vision care now is more ahead of surgical. But I have to say, I was presenting in Brussels 3 years ago, and I presented a lead generation platform, and that was it. And now in 3 years, we created a whole e-commerce. So things happened very quickly, and I never expected either that in vision care in 3 years we would have rolled out something like this. So I think it's something definitely that a next step would be to apply it to our surgical department and create a digital department within surgical, which I think doesn't exist yet.
Thank you.
So another question for you, actually. So what kind of team was behind this incredible project that you presented this morning? How many people and which kind of profiles were involved? How many agencies did you have to go and fetch to make it all happen? Because it was obviously very, very impressive. So it would be interesting, to understand which kind of organization is required for this kind of initiative.
So a lot of organization is required. And actually, it started, Mejor con Lentillas, so our D2C platform started in Spain as a D2C platform, a lead generation platform. But then in Contact, so of course the expansion to e-commerce was something that was developed together with EMEA, with our European department, because it's obviously something on a country level you cannot do on your own. It requires a lot of resources, a lot of money has been invested. So actually, I think it's always good within a company to centralize things, but at the same time have a market on board, kind of as a pilot country, in order to give all the market perspective and to really make it a collaboration between the two. But to answer your question, there were you need an external provider who makes the platform. So this is it's very costly because it's something that has constantly to be maintained. I think now we are in version 3.2.7, so you have basically every month a new version is made. So a good external provider. Then you have digital agencies, so more for the consumer side. Then internally, now there's an e-commerce department, but everyone in that department has come from different other functions within the company. Some people have been hired externally, but a lot of people were doing other things and have done this on the side, and now are solely focusing just on this. But still, a lot of people are still being hired. So I don't know. I think it's a difficult question to answer because I think there's a lot of people working on e-commerce, but that are not just dedicated to e-commerce, but from all kinds of different departments. But it's a huge project. I know we've invested, I think, more than 10 million on the whole project. So it's a lot, but it's what you need to do in order to get to the future. Because I was talking to someone before, you're not just a contact lens manufacturer anymore. You're actually someone providing much more than that. You're providing a whole new business model, a whole new service. And for the company to go there, it needs a lot of investment and resources. But you manage to be so much more for your clients than just you're a real partner.
And IT. You had IT involved. Yes. Okay. Because it's something that always strikes me. It's kind of what I also tried to relate to a little bit in that quote that you fetched from my email. We rarely hear about IT in these digital stream discussions, and still they're often behind us, making it all happen. So hats off to them. But at the same time, all these new tools and platforms that arrive, all these new tools and platforms that I presented, that we've been hearing of, there's probably your platform, you will have QStream, you will have other platforms, are extremely easy to clock and get them to play immediately, which often means that they kind of get in through the kitchen door and talk to marketing or sales or somebody else from business and gets it up and running as a quick pilot, and then it's running in the family immediately. And sometimes I can imagine that this can become a bit of a mess. So it's something to keep in mind, the architecture behind it. So hopefully you can get IT partners inside your company that understands that this is something that just needs to happen, but that can still be collaborative and make it correctly link up with more heavy systems such as CRM, SAP in our case as well.
Well, then a question tying a bit into the discussion as is, and it's to you, Ashutosh. So you presented a very sort of patient-centric model that you've developed and rolled out. So could you perhaps put some words around how actually to sort of prove performance matrices ROI on an exercise that is carried out by other people than the one actually delivering the actual application and technologies behind it?
All right, so yeah, this is a very important part, especially when you're running a pilot phase project with a clinic, and then you want to commercialize it directly after pilot, and you have to prove to the customer the technology that basically you are introducing in their practice really have generated value. Now, how we tend to do it with a kind of a metrics-based system where we send reports. There are certain questions in there. For example, how many times, for example, a surgery was prevented from being cancellation. So how many surgery was prevented in a month from cancellation using the platform? How many times, so we can get, all right, how much is the patient using the particular app, or how much time did the patient spend on the app? Further, this is again going into long term, but basically, if you can perhaps prove that out of the whole 4 months pilot, even if 2 patients which can fall into that range of infection and going through a revision surgery once again, were called in early and saved from that revision surgery, you're already saving over 100,000 euros for a hospital or for the system. And that's already a metrics enough for them to prove that the technology definitely generates value. But yeah, it's not just that, it's much more than that in terms, but what is very important is that you have to have a metrics, and then you're talking to your partner on a daily basis, so not on a daily basis, but maybe every 4 weeks basis, showing, all right, this is the performance, this is where it's going on. Because one thing that you have to take care of, you might start with a pilot, but your partner hospital might not put in enough patients, and data and statistics needs data, and in the end of after 4 months, what you don't want to see is only 3 patients there or 10 patients there. You want it to maximize it up to 60 to 100, to get that foundation going and saying that, all right, look, the technology really generates value in that terms.
Any question from the audience, or else I'll just keep shooting at you guys, basically. So we spoke about how to prove ROI on a more sort of patient centricity view. So in terms of the day-to-day marketing efforts, so we've heard about a lot of investments in terms of CRM platforms, e-commerce platforms, and we've spoken about the challenges around IT. Do we have IT on board? Don't we have IT on board? And I think perhaps a few observations would be interesting from how you sort of perspective this in daily life. Is IT typically the driver of these sort of projects, or do they need to be brought on board, and do they need to be educated? Does IT need to be educated? Yeah.
I can answer on the hospital side. And definitely they should be educated much more, especially with regards to GDPR, because the challenge that what we face, especially. So of course, you are well prepared. You must have done your homework, as a company. And clearly, I bet every company which is bringing a solution now, making sure that they are fully GDPR compliant. Now, when you go to a hospital, so the challenge doesn't come from the clinical partner. So when I say clinical partner, that means the doctors and the nurses, so the medical staff basically involved. they are all fine going forward. The challenge starts when you talk to the administration, especially to the IT folks. And again, the problem is fear. So GDPR is a big fear for them. And the problem is that they don't want it to be set as a decision maker who signed in on the contract that this is all compliant with GDPR. They don't want to take the responsibility at all. And on one side, what they wanted to do is that push it further. So you better should have a salesperson, because visiting and seeing them face to face, where is your problem? And at times getting them out. And I have certain clinics as example where they say that I am just not the right person to sign it off. And you might have to go to a little higher level person and they connect you. So this fear, so definitely there is, the problem with IT is that I always say, can you say one question or two questions where there is problem? And when I know the questions, I can find the right person to answer it for you. But to draft, where is the fear and what's the problem? They don't know what questions to project. The best way going out from our experience is that bring a data lawyer and let him talk to them. What this does is that they have a shoulder where they can throw over the responsibility to. And in the end, then say, all right, there was a IT digital lawyer we talked to, and he was all fine with this, so it's all fine. I just I threw away my responsibility there. So that's the practical situation in the market. So to answer if IT needs to be educated or not, I think definitely in terms of GDPR, they should go through what the GDPR is and should not fear it. It's actually protecting them even more. The industry should be more feared about them rather than the end user.
Well, yeah, I completely agree. I mean, all the conversations that we had with our big clients for launching the platform, at the let's say that the the gatekeeper was definitely IT, and we did exactly the same thing. We brought along our legal department and the one specialized in data privacy, and basically any doubts, questions they had, because I think it's the same. Usually it's fear and just also not willing to work more on or to have more work because of this. So they want things to be simple, and they don't want to have any responsibility when it comes to these kind of things. So as long as you make it easy for them, and you already come with only solutions to any fears they can have, which you easily find out in the first conversation you have with a client, because mostly they all have the same fears. Then I think it's, you need to create kind of this, well, at least what we did, working group where you have just from every department, you have one person who's really the ambassador of e-commerce. And with that group, you discuss all possible fears that any person from any department can have, also within your clients, in order to launch.
Cool. I think that we're just closing up on 4 o'clock, and the final question I thought that I'll ask to the panel is that, based on all the discussions that we've had, all the presentations we've seen during the day, perhaps interesting to understand, where do you see the next channel? What is the next channel that you would be looking at challenging the HCP environment or community? And so we've now touched on the sales enablement, we've touched on the e-commerce platforms, we've talked about tools. Where's the biggest impact, as you sort of see it in your lives over the next days, years?
Well, one thing that I'm seeing, or I think, is at the retail. So now that we have online platforms, products are being bought online. For example, the consumer can now, well, in our case, receive the product at home. So what is retail going to do still? Like, what do they have to do to keep consumers coming to the point of sale? And it's not that, what we thought everything's going online. I mean, Amazon is opening offline stores. So I think it's this combination of on-offline, especially what is the offline going to look like in the future? What kind of stores are they going to be? What kind of experiences are they going to give consumers? And how are they going to survive in this whole omni-channel environment?
Other perspectives?
Oh, yeah. Very conservative.
I mean, from my side, I think there is a big market coming up. How do you attract a patient, basically, in a healthcare environment? Because so far, he has been not at all asked. Now, it's a value-based system coming up. It's always at the patient at the center of everything. Now, you cannot directly market to patient. That's not allowed under GDPR, and at least in Europe. But then it's the challenge. Still, you have to keep him engaged and attractive. And this opens multiple avenues. How do you want to do it? On one side, you don't have to directly market the stuff to him or your products. But on the other side, again, you have to provide the best service. So he's kind of engaged to the product. And I think, of course, why this is challenging, because so far, as a medical device people, we have been stopping the story. B2B, sell it to the business partner, that's it. And now, of course, you have to sell it to the business partner, because in the end, he's going to pay for that. A patient is just paying with data, as an end user. But again, he or she is the most important user in the game, because if he or she doesn't like the service, nobody can force him to use it. So centricity towards patient, I think that's very important in future.
Speaking of patients is the best way possible to finish the discussion today. So I just want to thank the panel for volunteering to take part in the discussion and sharing some even more insights. Caroline for jumping in at the sort of last minute of things. And I think that if I were to take my takeaways from the day, I'd just like to thank all the presenters. I think we've seen sort of a wide variety of actions and actionable things that are being done out there. I think that I'm still hearing the word pilot all the time. I think that it seems to be the one thing that's the denominator of all, is that there are still so many pilots going on, so many learnings being made, and I think there's no definitive solution to sort of just go fix. But what I'm taking with me, at least from the day, is that we still see the heavy investments and around the CRM platforms. We still see lead generation, e-commerce as a vital thing, and I think that connecting brick and mortar, as you just mentioned, Caroline, into the equation of multi-channel marketing is definitely an interesting next step. So I think a big applause for the panel. I think it's.